His- History taking is an art. All clinicians must master it. Patients must be allowed to narrate their grievances without any fear or inhibition. Date of birth is an important for certificates. Cause of death to be given or postmortem is advised to find out the cause of death. Cause of death is also necessary for the classification of disease. The patient's demographic data, patient's informant must be recorded, outdoor number, indoor number, the hospital records, name of the patient, age, sex, address also is very important. The clinician must know from which area the patient is coming from. Certain diseases are very prevalent in a particular area. Say, for example, hilly areas in the Gujarat, like Dahod, are many patients are suffering from iron deficiency goiter. In Bharuch, there are many cases of elephantiasis. So that must be recorded. Date of admission, date of operation, date of discharge or date of death and final diagnosis. These are all very important. Date of death is important for certificate. Cause of death to be given or postmortem is advised to find out the cause of death. Cause of death is also necessary for the international international classification of disease. Past history of similar attacks is helpful in arriving at the diagnosis. For example, appendicitis, heart attack, urinary colic, recurrent dislocation of the joint, shoulder joint, etc. Sickle cell disease, there are repeated attacks of jaundice and joint pain. Building diastasis is in many family members. Tobacco addiction, similarly, is in the family is related to thromboangiitis obliterans. Many members of the family might be affected. Many members of the family might be suffering from diabetes. Carcinoma breast is can also run in family. So far as carcinoma breast is concerned, the patient is to be managed definitely, but her daughters or first degree relative, her mother, her sisters must be evaluated in case of carcinoma breast. That is very important. Then recording of the chief complaint is the main task. Chief complaint in the patient's main words, and it must be recorded in the chronological order. Then only it's significant. As for example, Murphy's triad, pain in abdomen, vomiting, and fever. In that sequence, all it is very important. If the sequence is reversed, it is not diagnostic of appendicitis. Past history, then personal history, habits, night sleep, eh, diet, etc., must be inquired into. Family history, how many members are there in the family? That is important. Sickle cell disease, obstetric and gynec history in case of female patients, how many children the patient is having, how, gera, gravida, para, and any abortions. Then very important is the last menstrual period. Person date must be recorded. Then education of the patient is very important so far as the management is concerned. A learned patient or educated patient can understand the importance what we are telling and emphasizing the history of repeated visits like that. Last menstrual period is important. Certain diseases can be diagnosed better. Say lump in breast can be defined better after menses period is over, where the hormonal levels are low. Then education, the patient can understand what we are telling to the patient. Occupation, say vehicle driving, the vibrations can lead to vibratory disease, that is TAO. Occupation as a laborer, patient can have disease which the patient is ignorant or may not be able to manage properly. Patients needs education for diagnosis of tuberculosis and therapy for tuberculosis. Addiction, say tobacco in any form, drugs in any form. These addictions are very important and they must be known to the clinician. Systemic review. Cardinal symptoms of all the system of the body. Example, respiratory system, complaint of cough, hemoptysis, dyspnea, cardiovascular system, chest pain, dyspnea, or on exertion, giddiness, TIA, that is transient ischemic attack, CVS, headache, blurring of vision, abnormal movements, difficulty in walking, gastrointestinal symptoms, hematobasis, diarrhea, vomiting, constipation, due to dysuria, hematuria, frequency of mutilation, dysmenorrhea, sterility, musculoskeletal system, difficulty in walking, squatting. Then drug treatment history must be taken. Patient might be on some drugs, either antihypertensive, antidiabetic, or other drugs. Then we come to general examination of the patient of the patient's entry in OPD. It starts at the time of right from the entry of the patient into OPD. An expert clinician can arrive at the diagnosis the moment he sees the patient. Patient may present with typical look of the face, that is called faces. Then the clinician must note that I have examined the patient after taking patient's consent in adequate light and adequate exposure, nipple to knee for abdomen, in standing and supine position, in presence of nurse or a female attendant. As for example, the patient is conscious, cooperative, fairly built and fairly nourished, well oriented in time, place, and person. So higher functions are recorded first. Then vital data, temperature, pulse, BP, and respiratory rate. These are called vitals because any abnormality of these indices points to the serious illness in the patient. Patient may present with typical look of the faces. Temperature might be high or low than normal. Hyperpyrexia is defined as temperature more than 105 degrees Fahrenheit. Pulse is to be recorded, maybe normal. Patient may have tachycardia, patient may have bradycardia. Tachycardia means pulse more than 90 per minute, and bradycardia means less than 60 beats per minute. Relative tachycardia and relative bradycardia is very important for the diagnosis of typhoid fever. For every 1 degree rise of temperature, 10 beats pulse rate must rise. Instead of that, if it is decreased or not decreased, then it is relative bradycardia. Bradycardia, its pulse required is 7 and 10, but it is only 80. So these features are diagnostic of typhoid fever, relative bradycardia, relative tachycardia. Blood pressure must be recorded. maybe low in hypovolumic shock and maybe high in Hedinger in intracerebral hematoma. Then starting with the head to toe examination, sclera has to be examined for jaundice, yellow color, blue in osteogenesis imperfecta, then subconjunctival hemorrhage in fractured zygoma. Then pupils are to be examined for size and reaction to light, and unequal pupils, Hutchinson's pupil suggestive of extradual hematoma or subdual hematoma. Puffiness of face may be due to the renal failure. Trismus, that is lockjaw, occurs in tetanus. Dental caries must be examined for. Then ill-fitting dentures are very important. They must be looked for because they can cause problem during anesthesia or endotracheal intubation. Tonsils must be looked for. Tongue for growth and pallor must be examined. Then engorgement of the neck veins must be seen in a recumbent position. Cervical lymph nodes must be examined. They are enlarged in tuberculosis. Thyroid swelling and swelling if present must be examined in a systematic way. Chest for any obvious deformity. Abdomen for visible lump. Then puffiness of face occurs in renal failure. Pupils, unequal pupils, that is Hutchinson's pupil, ENT, ear, nose, and throat must be examined. Trismus, dentures, hairs, eyebrows. Eyebrows are lost or become scanty in case of myxedema. Then pallor must be seen for. The loss of furrows on the forehead occurs in hemiplegia or cerebrovascular stroke. Nails must be examined for koilonychia or clubbing, and grading of the nails must be documented. Then cervical lymph nodes, axillary lymph nodes, inguinal lymph nodes, thyroid swelling, chest examination, abdomen, external genitalia, they must be examined for any abnormality. Lower extremities for varicose veins, pitting edema over limbs, examination of the abdomen for movement of abdominal wall and aspirations, absent in peritonitis, scrotum, testes, prepuce, urethral meatus, stenosis, external hemorrhoids must be examined for. Abdomen must be examined in a systematic way with inspection, palpation, percussion, and auscultation. In inspection, the movement of the abdominal wall and aspiration are maybe absent or minimal due to peritonitis. Then visible lump, visible peristalsis must be looked for. On palpation, one must look for tenderness. Tenderness in the iliac fossa, McBurney's is a diagnostic of acute appendicitis. Then tenderness can occur in strangulation of the bowel. Then rebound tenderness appears in early appendicitis, unruptured appendicitis. A rebound tenderness must be looked for. Then, if any lump is palpable, characteristic of the lump must be determined. It may be biminutely palpable, ballotable or not. Size, shape, lump must be determined. It must be determined. The margin of the age of the lump must be determined. There might be splenomegaly. There might be hepatomegaly. Splenomegaly is the left side of the upper quadrant of the abdomen, and enlarged spleen is defined or designated or identified by a notch on the lower border of the spleen. Liver may be soft, liver may be firm, and there might be multiple nodules of the liver which must be examined, suggestive of secondaries in the liver. Then hernial sites, deepening occlusion test must be performed. external genitalia, one must look for testicular tumors as well. Then palpation, while leg raising test or head raising test, you must look for whether the lump is intraperitoneal or extraperitoneal. That is very important. Then percussion, tenderness on tapping is suggestive is an unequivocal sign of peritonitis. Then shifting dullness must be looked for in case of ascites, or shifting dullness may be absent in case of the splenic rupture hematoma, what is called Balance's sign. Then dullness in the suprapubic region is highly suggestive of full bladder. Full bladder is diagnosed by percussion in the suprapubic region. Renal angle must be looked for in case of tenderness, for tenderness, where in case of pyelonephritis or pyonephrosis, renal angle might be tender. Auscultation of the abdomen must be done for peristaltic sounds. Then back and spine must be examined in case it is a part and parcel of abdominal examination. That is very important. And hernial sites must be looked for. PR examination is must be done. It should not be avoided. No abdominal examination is complete without rectal examinations. You might get ballooning of the rectum, or growth in the rectum causing intestinal obstruction. Hemorrhoids must be looked for. Then, in case of female, perspective and pervaginal examination must be carried out routinely. Then, systemic examination, uh, respiratory system in the methodical way, inspection, palpation, percussion, auscultation. One must look for respiratory distress. One might uh, find out any obvious deformity of the chest. Palpation to look for expansion of the chest during breathing. Percussion, a drum-like percussion note is suggestive of tension pneumothorax, which is an emergency. Then auscultation for the breath sounds, bronchial breathing or amphoric breathing, presence of rhonchi, rales must be looked for. Rhonchi and rales at the base of the lungs suggest the left ventricular failure. Then bronchi are also present in case of left ventricular failure. The cardiovascular system inspection look for apex, location of the apex, position of the apex beat, palpation for bruit in the second intercostal space in the pulmonary area, then bruit or thrill. Bruit, thrill may be palpable and bruit is audible. Presence of thrill or bruit indicates organic murmur. Then heart sounds must be auscultated. Any area of murmur must be looked for presence of murmur. The heart sounds P1, P2, M1, M, M2. This must be looked for. And systolic murmur or diastolic murmur must be defined. Presence of thrill is highly suggestive of organic disease of the heart valve. Then, in case of pericardial effusion, the heart sounds may be of very low magnitude. Heart sounds may be barely audible. Then, genitourinary system, same way, inspection, palpation, percussion, auscultation. Inspection must be done for diffuse meatal stenosis, any ectopic test is presence of hernia one must look for. Percussion in the suprapubic region. Fullness or dullness is suggestive of full urinary bladder. It is In the a midline swelling in the suprapubic region, dull on percussion is urinary bladder unless proved otherwise. Auscultation must be done for any renal artery stenosis in the back area. There might be systolic murmur. Then central nervous system must be examined in the with the headings under the headings of higher functions, cranial nerves, sensory system, motor system, reflexes and gait, musculoskeletal system, inspection, palpation, percussion, auscultation. Say, for example, soft tissue sarcoma, hematoma, one must look for. There might be visible, there might be aneurysm, arteriovenous fistula, there might be audible sounds. So they must be auscultated for in case of soft tissue sarcoma. Special clinical examination must be done, say fundoscopy and diabetic retinopathy. This fundoscopy for diabetic retinopathy must be looked for. Then indirect laryngoscopy for vocal cords. These are part of routine clinical examinations. Then after examining all these systems and all the known parameters or indices, one must arrive at a provisional clinical diagnosis. This is a must. If we if we arrive at a diagnosis, then only we can advise some investigations based on that diagnosis, which might prove to be correct or which might prove to be wrong, and something else might come up so far the diagnosis is concerned. So that has to be proved or disproved by investigations. So next comes the investigations, say routine blood investigations, X-ray chest, X-ray abdomen, CT scan, then MRI if needed. One might have to go for PET scan, positron emission tomography, then histopathology examination after taking FNSE or certain procedure might be done. Then radioisotope scanning might be done, hormonal level might be assessed, and finally, one must come to the final diagnosis. That is, one has to come at a diagnosis. You can't investigate or go on investigating or go on trying different methods of examination. That is not correct. One must come at the final after the investigation reports are achieved or retrieved. One comes to final diagnosis. Treatment history, operative notes must be documented. Rehabilitation of the patient is important, and ultimate outcome of the patient, the result. That is, you can come to the ultimate result of the patient or ultimate outcome of the patient's illness. So it is said by Hamilton Bailey that you can always be a better clinician. Then wards are the greatest of all the laboratories in the world. It is said that Harrison used to stay in the ward itself day and night and continuously examine the patient and observing the patient's signs, symptoms. That is why the great stalwart Harrison has written a book on medicines. And similarly, we must remain present in the ward. We must examine the patient first, and that will create a rapport for the patient, and further the patient will be confident. Okay, doctors are interested in my illness, and the patient will be very happy. So this is how a rapport is created, and this is how we take the history. So history taking is the most important part of the clinical examination by any clinician. The readers are requested to refer the book Experiences in Clinical Surgery by first edition 2023 by Dr. G.R. Patel, the basic foundation, where the there has been given a basic foundation for the medicos to take the history. Thank you. You will be the best clinician.